Hi everybody, welcome to Healthline. I am Gregory Zarian. So summer is in full swing. As I say often, do you get up, do you get out, do you get off your phone, do you turn off the TV, do you spend more time with your friends, with your family, do you just check out and check out into the world? We here at Healthline and I always invite you to be as healthy as possible, to be as active as possible, and to have fun. As we all live in this precarious world, it still means pay attention, wash your hands, throw on your mask. If you haven't been vaccinated, get vaxxed, get boosted. Do all the right things for you that keep you as healthy as possible. So, as I always invite you to get up and get out and move and run and do all these things within your capacity and capability, sometimes you get hurt. Sometimes you trip, sometimes you fall, sometimes you wake up and you're like, what the heck is that? So today I thought I would help you and share with you what you need to know about your meniscus. Well, do you know what a meniscus is? Do you know where it is? Joining us from Adventist Health Glendale, sports medicine extraordinaire, Dr. Ryan Morgan. Welcome back, Doctor.
Hi, thanks for having me. Good to be back.
I missed you, so I'm glad you came back.
Of course.
It wasn't too painful the first time.
No.
How are you? Are you good? Are you well?
Yeah, doing well, enjoying summer, getting out and about, like you said, trying to do that the right way, the safe way. And so today, appreciate you having me to talk about the meniscus. So
I am a meniscal surgery alumni. I double tear on the right, single tear on the left. And from Adventist Health Glendale, Dr. Phil Merritt did this surgery. And as much as I hated that it all happened, I'm really grateful for the repairs on both legs, both knees, both meniscus, because physical therapy really saved me. Going into it, I was trying to be as proactive as possible, and coming out of it the same. First and foremost, doctor, tell us where the meniscus is.
Right, so the meniscus is in the knee. I have a little knee model here. The meniscus is little shock absorbers inside the knee. So we have the thigh bone called the femur and the shin bone called the tibia. Now on top of the tibia are these two little C-shaped shock absorbers that we call the meniscus. And there's one on the inside part of the knee, we call that the medial side, and one on the outside part of the knee called the lateral side. And so they both function to protect the knee cartilage from wear and keep the knee stable.
We're going to put a pause in that because
Sure.
I love a good cliffhanger. And I didn't even give you a cliffhanger. Okay, so here's a question. Does your hamstring or your, what is this ligament called?
The IT band?
Do your hamstrings and your IT band connect? See, it's a cliffhanger. I'll give you the answer when we come back. Don't go away. Welcome back to Healthline. My name is Gregory Zarian, and today we're talking all about the meniscus. Joining us from Adventist Health Glendale is Dr. Ryan Morgan, sports medicine extraordinaire. And I left you with a cliffhanger. That was my paper drops. I left you with a cliffhanger, and the cliffhanger was this. Does your IT band connect to your hamstring? And the answer, doctor, is?
No, they don't connect, but they are important structures around the knee. So the hamstrings are the muscles in the back of the thigh, and they actually attach onto the back of the knee.
Okay.
And some of them actually wrap around and attach onto the front inside part of the knee. Whereas the IT band is on the opposite side. It's on the outside part of the knee, comes across the knee and attaches onto the outside part of the knee. So you can have injury or tendinitis to those structures, and it can sometimes present like a meniscus tear would. So it's important to do a proper exam and understand where is the pain coming from. Is it a meniscus issue, or is it a hamstring or IT band tendinitis?
And that's why you then get up and get out and see someone like Dr. Ryan Morgan. So doctor, here's a simple question. How easy is it to tear the meniscus?
Well, unfortunately, the meniscus tears are very common.
Okay.
We see them in all ages, all populations. You can have tears from an injury, which we see in our younger patients.
And when you say injury, are you talking
like
about?
Sports injury, or even just running. You pivot, you twist a certain way. That meniscus gets pinched
That's
between
what
the
happened
bones.
on my first.
Yeah.
I was running down here in LA. We have Runyon Canyon, and I'm a runner. And I saw a friend, and I was on my way to her wedding, and she said something, and I said something back, and I turned toward her, and I felt the snap.
Yep.
So it was a double meniscal tear.
Yeah. So that's often what we hear is patients pivot a certain way, they hear a pop, and they feel something immediately.
Is there a certain way one should pivot then? Or is it just sometimes life just happens?
I think sometimes life just happens, but there are things we can talk about as far as injury prevention, proper warm-up that we can get into.
I love that.
So the other type of tears are kind of the more wear and tear or degenerative. And those are very common as well, we see as folks get older. The problem with the meniscus is it doesn't have very good blood supply. And so once it tears, it doesn't have the ability to repair itself. So little tears can happen through just normal wear and tear of life. Over a period of years, those tears get bigger until the tear becomes big enough or a certain location where it starts to tell your brain, hey, something's going on here. So a lot of people live with meniscus tears, don't even know they have them yet.
So even as a visual though, just think of a rubber band.
Yeah.
And a rubber band, just the more you stretch it, the more it frays and threads, and then all of a sudden it breaks.
Right. Yeah. The meniscus, they are elastic.
Okay.
They are a rubbery cartilage shock absorber, and so that elasticity wears out over time as well, just like it does in our skin, right?
Sure.
We lose that elasticity. Same thing with our meniscus or our shoulder, our rotator cuff. These tissues wear out over time. And in certain areas of the body where you don't have great blood flow, they can't fix themselves. So they become problematic for a lot of folks.
What are I know you said on the inside and the outside, are the signs and symptoms the same?
Yeah, so typically someone's going to come in, they're going to complain of pain, and they can usually point to one area, and it's going to be on that joint line. So what we mean there is that
back to show and tell, which I love.
Yeah, between the bones, right, at that joint line where the thigh bone meets the shin bone, right there, people say, that hurts if it's a medial meniscus tear, or same thing on the other side if it's the lateral meniscus tear. So it's going to be that joint line pain. And people are typically going to say it's worse with pivoting and twisting, like you'd mentioned. It can be worse with deep squats, stairs. Sometimes if a tear gets big enough, it can actually cause catching or locking where the knee feels like it's getting stuck.
And then you feel it pop.
Right, and then you feel it pop as it kind of pops back into place. Sometimes the knee can even lock where it gets stuck or give out where you feel like you're going to buckle and you're going to fall. So these are all symptoms that we commonly hear with our folks with meniscus tears.
Is it a dull pain, or is it more of a burning sharp pain?
It's usually more of a sharp pain.
Okay.
That dull kind of achy pain that you might get at the end of the day or after a lot of activity can be some mild arthritis, which the two can go hand in hand, especially as we get older.
You made a comment about squats. I know I see a lot of people at the gym that will squat and do, without weights or whatever, do squats and go super low.
Right.
Do people go too low?
I think they do.
Yeah, because I mean, for me, the best I can do is, I don't even know. Yeah, the best I can do, I'm doing a visual. The best I can do is, since I've had them both done, and I know that I need my knees shoulder width apart.
Yep.
And it's got to be very intentional, because I don't want to do anything where I get hurt.
Right.
But so when I squat, I only go here and I go up, and I use my behind. A lot of people over squat over their knees or do stuff with their ankle. How do we know if we're going too low, and how do we not injure our meniscus going that low?
Right. So I think that you demonstrated some important points there. One is how deep you go with the squat. There's no benefit to going below a 90-degree angle. You're not going to activate any additional muscle groups or provide any additional strength opportunities by squatting that low.
Okay.
So that level of squat that you demonstrated, or to a 90-degree angle, kind of like your chair height here, is kind of as much as you really need to activate all those muscle groups. Beyond that, you're just going to be putting additional stress on the meniscus.
Okay.
The other thing that you demonstrated, which was important, was your feet were rotated out slightly to decrease the stress on the meniscus, because our knees naturally twist a little bit as we flex and extend. And so by putting that in a better mechanical position, you're going to put less stress on the meniscus. Having the legs shoulder width apart, all important positions to protect the meniscus while you work out.
So this is a thank you to all my physical therapists and everybody I've ever worked out with. You have not been wrong. More with Dr. Morgan when we come back. Don't go away. Welcome back, and I hope you maybe did some air squats. My name is Gregory Zarian. This is Healthline, and today we're talking about your meniscus, meniscal tears, and preventative movements to not end up in the surgical center. Joining us from Adventist Health Glendale is Dr. Ryan Morgan. Sports medicine is his specialty. I like that we talked about proper, and I did the visual of a proper squat and all of that. So even when we sit, per se, in a chair, is there a perfect ergonomic way to sit in the chair that we do not hurt our knees and our meniscus? Or
yeah, well, again, anything beyond a 90-degree angle, which is just where you're sitting,
okay,
is going to put extra stress on the meniscus. I know a lot of people like to sit on the couch with their leg folded under them, do these deep knee bends, and that can put some extra stress on the meniscus.
Okay.
But that's not typically what's going to cause a meniscus tear, is just being seated. It's going to be more of the activities. Yeah. But just say you feel a little bit of a strain in the meniscus, yeah, and just say if you're sitting on your leg and you put it out and then you put your leg back and it's gone, could it just be your body saying, hey, not the best position for you? Right. So meniscus tears come in multiple different types. Okay. So the way that the meniscus can tear can be horizontal, meaning kind of in parallel with the floor, or it can be up and down or front to back. And sometimes the different tears will present differently. So if you're having just a little minor pain, but none of the catching or locking or giving out like we talked about, that may be just a small horizontal tear where there's no torn piece that's displaced or flipped out of where it's supposed to be.
And can you live with that? And
sometimes you can, yeah.
Okay.
So I see patients often who have a small meniscus tear, right? The important thing is not every meniscus tear needs surgery,
okay,
right? Even if some don't heal, oftentimes you can live with it. I mean, if we MRI everybody over age 50, you're going to see about half to 2/3 of people have some damage to their meniscus, right? Most people don't even know if they have a tear. They could be living with one.
Most people don't even know what a meniscus is.
Right. So you don't have to have surgery for it.
Okay.
A lot of times we can successfully treat meniscus tears without surgery.
And how do you treat them without surgery then?
Right. So we typically start with physical therapy, strengthening the muscles, hamstrings, IT band, making sure we're using proper technique and how we're doing our exercise, and the therapy can really coach folks along in that capacity.
And also, but I also want to say too, though, is, and I'm sorry for cutting you off, but when you are given the prescription of physical therapy, that just doesn't mean that you go to the doctor's office and I'm going to see Dr. Morgan today for an hour and boom, it's done. That means you actually, if you're told to do it 4 to 5 times a week for an hour every day per se, you take your knees into your own hands and do what you are told. It is not just a quick fix. It is something that you need to maybe load more weight into your legs or your behind or stand differently.
Yeah.
And that will be part of your homework to do it outside of the office.
Right. So I have patients go to see the physical therapist in their office, and then maybe see him once or twice a week. But right, that's not where it ends. It becomes part of your daily routine and your regimen to maintain good strength and mobility about the joints. So I give people home exercises to work on in conjunction with what they're learning in physical therapy. And yeah, the goal is to incorporate it into your lifestyle so that we can not only fix the pain, but prevent it from coming back.
I love that. So a tear or a strain can be treated. What happens if somebody has a tear that then ends up having surgery? What does that look like for someone?
Right, so certain tears don't get better without surgery. Certain tears, if there's a piece of meniscus that's torn and flipped out of place, or a tear in the back of the meniscus, which we call the root, where it attaches to the bone, if that tears off of the bone, those types of tears need surgery. It's arthroscopic surgery. That means we use a camera, 2 little poke hole incisions on the front of the knee, we go in, and if it's a routine meniscus tear, we do a cleanup. So we kind of trim away the torn meniscus piece, shave it out, get it out of the knee. It takes about 30 minutes to do that procedure. If it's a repair, so certain types of tears need repairs, we have to put stitches in the meniscus to get that to heal. That recovery is a little bit longer, but that's not as common as the meniscus cleanup procedure.
When you say that you have to surgically reconnect, is the meniscus is it more taut?
So
is it tighter, or will it stretch out a little bit to acclimate to the knee and the structure of the knee?
Well, we're trying to restore the normal anatomy.
Got it.
There are certain tears where one's called a bucket handle tear,
Okay.
for example. So the meniscus, as I said, it's C-shaped. If that piece of meniscus flips into the middle of the knee, like a bucket handle can flip from one side of the bucket to the other, that needs to be repaired. So we put the bucket handle back, we put the meniscus back, and then we sew it in place. And so we're restoring the normal anatomy and allowing that to heal in place. In the instance of a meniscus root tear, which is again where the meniscus attaches onto the back of the knee, it has lost its tension. And so every time you step, it's like you're walking with no meniscus. And so in that instance, we have to reattach it down to the bone, restore that tension, like you mentioned, so that the meniscus can do its job, protect the knee cartilage, and make sure people don't go on to getting arthritis later in life.
And then you said also that then the knee will be cleaned up. What does that look like?
So in most meniscus tears, most common, the meniscus has tearing in a couple different places, and there's little fragments of meniscus tissue in the knee where it's not supposed to be.
Okay.
And so we go in with this little shaver, smaller than a pen. It goes in and just removes that tissue, and so that it's no longer pinching and catching in the knee, and that eliminates the pain.
Makes you just want to get your knee cleaned up, doesn't it? More Dr. Morgan when we come back. Don't go away. Welcome back. I am still Gregory Zarian. Joining us from Adventist Health Glendale is sports medicine extraordinaire, Dr. Ryan Morgan. Thank you for being so detailed about all of it, because I was thinking of it as you were talking about going in and cleaning up little bits of fragments, and it makes me think of like a shirt per se that just frays near the end, and if you want to keep it looking newer, you take scissors and cut off all the extra thread hanging off.
Right. Yeah, so I often use the analogy of like a package, right? When you first get a package in the mail, really hard to open that package, right?
Sure.
But as soon as you get a little rip in some of that tape, that package can open up the rest of the way, right? So we want to make that meniscus back to that nice, healthy package. Well sealed, so that the tears can't continue to extend or get worse.
Since I've had laparoscopic surgery on both knees, and I'm still doing great with both. Somebody has surgery, what is recovery like?
Yeah, so after surgery, I let people walk on it right away.
Because it could be mild or intense surgery.
Right.
No matter what, you have them get up and just...
Yeah, we want to get up and moving right away. So in a typical meniscus surgery, where it's a 20 to 30 minute operation to remove the torn fragments, people can walk on it right away, and we encourage therapy exercises beginning the first day after surgery. So I have a handout that I give all my patients with 4 basic exercises that they can start right away to get their knee moving and start their rehab. And then I start formal physical therapy usually about a week after the surgery. And allow some of the swelling to calm down, let the 2 little incisions heal up, and then we get them into more formal therapy at that point.
Do you suggest like icing of the knee and keeping the leg elevated and all of that?
Right, so first couple days I have people take it pretty easy. You want to ice the knee 3-4 times a day for about 20 to 30 minutes and limit your walking to just, around the house, do your day-to-day, but not any walking for exercise or anything beyond that. typically if patients have surgery with me on like a Thursday or Friday, they can go back to their desk job by Monday.
But that also means not getting up and running around the block because you're still recovering from surgery.
So after the first 2 weeks, then I let people get back into what we call low impact exercise. So more walking, stationary bike, or biking, on a flat road.
What about an elliptical?
Elliptical, exactly.
Okay.
Elliptical machine.
Swimming.
And swimming in the pool, right? So those are all the low impact exercises we start. Running and jumping, typically more like 6 to 8 weeks before I clear patients back to those activities.
Doctor, is there anything we can do to keep our meniscus strong?
All right, so I think overall joint health of the knee is important to talk about. And it begins with being active, staying fit, right? Because that's the number one thing you can do to prevent meniscus issues, is not putting too much stress across the knee. And on top of that, making sure people are exercising regularly to maintain good flexibility and strength around the knee so that the muscles can help support the knee, and it's not all up to the cartilage and meniscus to do all the work. Those muscles can provide some of that dynamic stability and support to protect the meniscus from injury.
But that also means when you work out properly. One thing I don't do is when I'm doing a lot more weightlifting and I don't want to become really big, but I also don't let my shoulders drop a lot lower than 90 degrees. I also will not overstrain, because if I go like this, I could knock out something in my neck, or I could hurt something. It's doing something very intentionally.
Right.
And if you have a question about it, ask a trainer, have someone spot you. If you don't know about it, because a lot of injuries come up with just making one quick move and boom, you're hurt.
Right. Yeah, proper technique is key. Using the proper amount of weight so that you can do enough reps and you're not maxing out and overstressing things. Because yeah, I see a lot of injuries in my office as a result of that. For the knee, I like the exercises like we talked about with the squats, doing the proper squat.
To 90.
Yep, to 90. Same thing with leg press.
Okay.
Hamstring curls. One exercise that people like to do but puts a lot of stress, particularly on that kneecap joint, are those leg extensions, where the weight is at the ankle
and you're
this, kicking the leg out,
okay.
right? Feels good, looks good for the quadricep strength, but it puts a lot of stress on the knee. So I see a lot of folks who aggravate their kneecap joint as a result of that exercise. So I tend to steer people away from that one and focus on the others.
But if someone does that though, I would rather have leaner muscles in my legs per se, and just do lighter weights.
Lighter weights.
And don't hyperextend.
Right.
Isn't that where the trouble comes in when you, because I will do it here, I won't go like that.
Right.
I'll just do it to almost the end because I don't want to go through the surgery again.
Right, yeah. Overextending and using too much weight in that scenario would be really hard on the knee.
How important is stretching before and after working out?
That was very important. I mean, I spent a lot of time talking about that proper warm-up and stretching. You're actually
what is a proper warm-up to you, doctor?
Well, I think you want to make sure that before you're lifting any weights, you're getting your heart rate up to that 60 to 70% zone for at least 10 minutes to make sure that muscles are warm before stretching. You're going to get more benefit of stretching actually at the end of the exercise session when all the muscles have had a chance to properly warm up and be activated. So I actually like the stretching more at the end of the workout as a result, and that's going to help elongate the muscles and helps get rid of some of that lactic acid that can cause that muscle fatigue and pain after a workout.
So basically though, more the stretching at the end, but before that, maybe throw in 30 jumping jacks, maybe walk around the block, maybe do something just to get your heart moving.
Exactly right.
Do you support supplements? There's joint repair. I'm a big fan of collagen. Mm-hmm. Do you support all of that?
So there's a lot of joint supplements out there, and not
glucosamine, chondroitin, all of stuff like that.
So you don't always know what you're getting. These are not FDA regulated, right? So you don't know the amounts of each ingredient that you're getting, and so each pharmaceutical supplement company may put out a different formulation. In general, they're safe. If they work for you, great. The ones that seem to have the best literature behind them in the medical journals is type 2 collagen.
Okay.
So that's a recent study that showed benefits in knee pain with type 2 collagen supplementation. The glucosamine chondroitin is very common, and a lot of people swear by that, but there hasn't been any papers to show that that benefits you pain-wise over a placebo.
Last question in regards to meniscal and knee health. What's the one thing off the top of your head that you want to leave us with?
Well, I would just say to make sure you stay active, stay fit, and when you do that, get out there with a proper warm-up and technique, and just gotta enjoy life. That's that's why we're here. So. And
also in regards to lifestyle and eating and all of that, stay off of alcohol to moderation, and say no to cigarettes and drugs. What does a healthy lifestyle look like to you, Doc?
Yeah, I think like what you said, live life in moderation. You don't want to overdo any one thing. You want to make sure that you're staying active and fit, and like you said, proper nutrition, all very important. Thank you for coming. Will you come back again? Sure, yeah. Okay, so far, great. We'll see you on number 3. So you heard it from Dr. Morgan. Just warm up, pay attention to what you do, how you do it. Stretch when you are done, and don't self-diagnose. If you feel something is chronic on the left side of the right side or any part of your body, call your doctor, make an appointment. The worst thing they will say is you are fine. Have a great conversation about you and your health. It's one of the most important ones you will ever have. And as I said earlier, wash your hands, pay attention, ask questions. We are in an ever-changing world. Talk to your doctors, talk to your family, talk to your friends. We are in this together, so why not support one another? I'm Gregory Zarin. Be safe, be well, and we'll see you next time. Thanks.